Bengaluru, 13th November 2025, Renewing Hope and Restoring Lives, Apollo Cancer Centre, Bannerghatta Road, Bengaluru, today unveiled its state-of-the-art cellular therapy and blood marrow transplant centre, marking a new milestone in advanced cancer and hematology care. This new center brings together multiple advanced cellular therapies and transplant modalities under one roof, helping patients receive world-class, evidence-based treatment right here in Karnataka. The launch was graced by leading specialists Dr. Neema Bhatt, Senior Consultant Hematology BMT Physician and Pediatric Oncology, Professor Dr. Vijay Agrawal, Senior and Lead Consultant Medical Oncology, Professor Dr. Vishwanath S., Senior Consultant and Academic Advisor Medical Oncology and Hemato-Oncology, Dr. Poonam Maurya and Dr. Aditya Murli, Senior Consultants in Medical and Hemato-Oncology, along with Mr. Akshay Oleti, CEO Karnataka Region, Apollo Hospitals. Speaking on the occasion, Dr. Neema Bhatt said, the center will serve patients with leukemia, lymphoma, multiple myeloma, thalassemia, and several other blood-related disorders, supported by a multidisciplinary team ensuring complete care from diagnosis to recovery. Professor Dr. Vishwanath has emphasized that the strength of this center lies in its protocol-driven approach, academic oversight, and strict infection control systems that ensure safe and successful transplants. Professor Dr. Vijay Agrawal highlighted that the future of cancer care lies in using the body's own cells to fight disease, and this center is designed to pioneer such next-generation cellular therapies. Mr. Akshay Oleti, CEO Karnataka Region, said this launch strengthens Karnataka's healthcare infrastructure, bringing Apollo's trusted expertise closer to home for patients across the state.
School sweetheart. They were engaged to be married about 3 years before. He had been diagnosed with lymphoma, which is a type of very severe blood cancer. He had undergone chemotherapy, about 3 lines of chemotherapy before that, and had only shown partial response. His disease had come back each and every time after the chemotherapy. He was very heartbroken. His fiancée was confused. What do we do? Do we go ahead with the marriage? Where are we going with the treatment of this disease? Are we really going to see cure? His lymphoma seemed to be an aggressive variety which had responded initially to chemotherapy upfront but had a tendency to come back. So we designed the plan so that we could give him what we call salvage chemotherapy or strong chemotherapy, and then do what is called an autologous stem cell transplant. So this is what we are going to talk about. We were fortunate enough to collect his stem cells, give him high-dose chemotherapy. He was in the transplant unit for about 2.5 weeks and got discharged. He is now about 2 years post-transplant and doing very well and disease-free, happily married. So what is this? What exactly is this treatment modality we are talking about? So briefly to explain what is a bone marrow transplant. Bone marrow is nothing but the soft tissue that is present inside bones, and this is sort of considered like the factory where your cells are made. So your red cells, white blood cells, your platelets are all produced in this factory. And in severe life-threatening diseases like leukemia, it could be lymphoma, can be aplastic anemia. In genetic disorders, especially in children, it can be thalassemia, again aplastic anemia, sickle cell anemia. They're all blood-related disorders where this bone marrow starts malfunctioning. It's basically not functioning normally. If you've heard of kidney transplant, liver transplant, so a normally functioning organ has to be given back, to the patient, so the organ can start functioning normally again. Bone marrow transplant is similar but not the same as a solid organ transplant in many ways. So it involves replacing the deceased or defective bone marrow with healthy stem cells. It can be taken from the patient's own body in diseases like lymphoma or myeloma, or it has to be taken from a matched donor. We do what is called HLA typing and find a fully matched donor or an appropriately matched donor and perform this procedure. These stem cells then find their own way into the bone marrow and start the generation of a healthy blood and immune system. In simple terms, bone marrow transplant gives patients, especially children and young adults, a second chance at life. We almost consider it a rebirth because they are being brought back from the brink of death and given a new lease at the chance of life. Why is it that a dedicated BMT and a cellular therapy unit important? So in a multi-specialty hospital like Apollo, that has been around for almost 20 years now, we have been doing all sorts of very high-end procedures, including cardiac, liver, kidney, also some autologous transplants. But the goal is to offer what we call allogeneic transplants and CAR T cell therapy or other cellular therapies that are now the newest technology that is coming to the forefront for treating oncology patients and patients with blood and cancer disorders. So we believe that a transplant unit cannot really exist in isolation. It needs the backbone of a multi-specialty hospital. Patients should be able to have access to advanced diagnostics, infection control, the appropriate critical care with the right intensivists being able to take care of these highly complicated patients, radiological services, transfusion medicine, so the right blood bank services are required, and a multidisciplinary medical supportive care all under one roof. Bone marrow transplantation is not a single procedure. It's not like taking the patient to the OT, replacing the deceased liver, and giving a new liver. It is a complicated procedure, and it's a journey that requires the coordinated efforts of hematologists, oncologists, infectious disease specialists, critical care physicians, highly skilled and trained nurses, psychologists that help us counseling, and advanced laboratory systems. Having all these experts and services seamlessly integrated in what allows us to deliver safe, efficient, and holistic care to every patient is what is going to make this Apollo Cellular Therapy and Blood and Marrow Transplant Unit significantly different. So, what are the high-end specialized procedures that we perform in our unit? So, this unit will be designed to meet international standards of safety, sterility, and infection control with positive pressure rooms, HEPA filtration, and dedicated nursing teams that are trained in transplants. We are proud to offer the full spectrum of cellular and transplant therapies, including what we have already been doing, autologous bone marrow transplantation, where the patient's own stem cells are taken away from their body, stored, and then after giving them high dose chemotherapy, it's reinfused back so that they can be cured of their blood cancers. Allogenic transplantation, which is where stem cells are obtained from a matched donor, and this is usually used in treatment for conditions called leukemia, aplastic anemia, genetic blood disorders like thalassemia, sickle cell anemia, and so on and so forth. Haploidentical transplants, which is where we don't find a full match for transplants from a donor in the community or from the family. So we may have to use what is called a 50% donor, and my colleagues will be elucidating or explaining a little bit more in detail about each of these techniques of transplant. Pediatric transplants, which is also my specialty, which is one of our strongest focuses, addresses the children with congenital bone marrow failure syndromes, thalassemia, sickle cell anemia, so genetic blood related disorders, leukemias, and lymphomas. Pediatric transplants demand a very meticulous expertise and emotional support for both families and the community, both of which we're going to be able to provide. CAR T cell therapy, about which Dr. Vishwanath, my colleague, will be talking about, and other advanced cellular therapies, we will talk about a little more in detail in the event of today's gathering. Specifically, pediatric transplants. When we hear the term bone marrow transplant, most people in the community, patients, and families think that it's a last resort procedure. It is going to be something that is going to put the patient at a high risk of mortality. The patients are not going to survive beyond this. But in the world of children's medicine, it's often a life saving treatment. So we know that patients with blood cancer only have a few months to live if they're really not responding to chemotherapy. So, what is it that comes to the forefront trying to save these children with blood cancers is bone marrow transplants. It's something that gives the young child a real chance at growing up healthy and fulfilling their dreams and being able to do their normal activities like going to school, playing with their friends, etc. etc. So, why is it that pediatric bone marrow transplant is special? And why is it so highly complicated? So, these stem cells are like the seeds from which all our blood and immune cells grow, as I've already told. But when a child's own marrow stops working or it produces abnormal cells like leukemia, replacing it with the healthy ones can completely replace or improve their blood and immune system. When do children need a bone marrow transplant? So, what conditions? I've already sort of given a briefing, mostly in blood cancers like leukemia, lymphomas, especially in patients who are not responding to upfront chemotherapies. Bone marrow failure syndromes like aplastic anemia, we have something called diamond black fan, Fanconi syndrome, where the child's bone marrow is just not working or it's failing. Genetic blood disorders like thalassemia, sickle cell anemia, where patients have severe anemia, organ dysfunction because of various blood transfusions, and these children will require bone marrow transplant as a form of permanent cure. Inherited immune deficiency, we call it SCIT or combined immunodeficiency, where the child's immune system is just not working normally, and immune system also originates in the bone marrow. This is where bone marrow transplants are also helpful. Metabolic and genetic diseases, where they are born with diseases where they can't really produce the required hormones, and enzymes that are required to maintain normal life, that is another part or area where bone marrow transplants really come to life. What makes pediatric transplants unique? Why is it that a dedicated transplant unit is required to do pediatric transplants? So, treating children is very different from treating adults. Children are not just small sized adults, is what most pediatric people will tell. Their bodies are still developing, their immune systems are quite delicate, their emotional needs are immense. They always come with attached families who require significant support in counseling them, taking them to this through this complicated journey. So, a pediatric transplant requires meticulous medical care, which is should also be combined with empathy, counseling, and significant family support. It involves a coordinated team, which usually comprises of pediatric hematologists, intensivists, infectious disease specialists, and nurses and psychologists and nutritionists, which we require all of them to come together working under the same roof so that this child can have a safe and healthy course. At Apollo hospitals, we perform all types of pediatric transplants, bone marrow transplants, autologous, allogeny, and haploidentical transplants, as well as matched unrelated donor transplants, where patients can either have a match in their own family, a full match, or a 50% match from their own parent, or a match from the community or a pool of bone marrow donors. So, specifically, something like haploidentical transplant has been a significant game changer for Indian families because not all families are able to afford the bone marrow that comes from the community or a pool of donors because it costs quite heavy. So, I'd just like to mention another small story over here before I start closing my speech. So, we had a 6-month-old baby who was diagnosed at the age of 5 months with severe congenital MDS, myelodysplastic syndrome, which is basically a disease where the bone marrow is not functioning or it's failing and would lead to cancer or acute blood cancer. The child was the only child, no siblings available in the family, and we did not have enough time to actually find donor from the community. The initial search, we did not find any fully matched donors. Father thankfully had a 50% match with the child, and we went ahead and did a transplant for this child. And the child is now about 3.5 years post transplant, free from his MDS, does not have blood cancer, and is starting to attend school. So, something as magical as giving a second lease at life is what bone marrow transplants are meant to do. Every successful transplant is not just a medical triumph, it's a story of a family's strength and a child's resilience. So I've seen children who've not been able to get out of their room, especially in immunocompromised diseases. After transplant, they're able to go out, mingle with their friends, play, go to school, and have a normal, healthy life. So, as part of the broader vision, with the help of our Apollo marketing team, our corporate office, Mr. Akshay sir, we really thank the Apollo management for giving us an opportunity to start the state of the art transplant and cellular therapy unit and hope to be able to give back to the community bounds, leaps and bounds more than what we've already been doing. Thank you for joining us.
When this therapy actually came into existence, and since then we've seen several patients, like Dr. Nima mentioned, some patients with relapsed lymphoma where we do some autologous stem cell transplant. But apart from that, this particular novel therapy where patients relapse and these high grade, very aggressive lymphomas and childhood leukemias, they have a very dismal overall survival. And that is where this novel therapy called CAR T cell therapy came into existence. And since then, there is a huge number of patients who have had a cure out of this deadly disease. And the cure rate with this particular novel therapy is in the tune of 50 to 70%. Long term cure we are talking about. This is definitely a novel therapy. So what is this CAR T therapy or CAR T cell therapy? In very simple terms, it is just reprogramming the patient's own T cells. In our body, we have what is called as T cells or immune cells, and, uh, and the whole idea is to reprogram a patient's own T cells to kill the cancer cells. That is how this CAR T cell therapy works. So there is a virus which is very harmless, which is generally what we use as a lentivirus, which is very harmless, and that what it does is it is used as a carrier to get that CAR or chimeric antigen receptor, that gene, onto these T cells, and then these T cells are made to multiply in the lab and then push back into the patient's body, and that's how these cells go and kill the cancer cells. That's the whole principle of this CAR T cell therapy. So, just to explain the procedure in very brief, so what we do is we generally have a patient who's got a relapsed B cell lymphoma or an aggressive lymphoma or a childhood leukemia. So, like I said, these patients have a very dismal survival. So we have some prerequisite investigations. Once we know that these patients are eligible for this CAR T cell therapy, we do what is called as apheresis. Apheresis is just taking out the patient's own T cells. We pull out the T cells, and then these T cells are sent to a lab. So we have two centers, one in Bangalore and one in Mumbai. So there is a company called ImmunoAct, and then there's something called ImmuNeal in Bangalore. So either of these centers have got affiliation with the Apollo hospitals, the entire Apollo chain of hospitals. And these T cells are sent to a lab, and then they are genetically reprogrammed, and it takes around 21 days, and then it comes back to our center. It's 5 days before the cells are likely to come back. We admit the patient and we give what is called as some kind of conditioning chemotherapy, and then these cells are given back to the patient's body, which are reprogrammed. And then over the next 2 weeks, the patient is admitted in the hospital. That's when they can have, because these are genetically reprogrammed cells, the patients are likely to have certain side effects called cytokine release syndrome, because these cells can release certain inflammatory mediators. So the cytokine release syndrome can be very minimal. It can just manifest as fever, or sometimes the patient can have shortness of breath, hypoxia, breathing difficulty, and they can also have low blood pressure. It can become very serious, and it also can become life-threatening. So this is a spectrum. It's called cytokine release syndrome. Sometimes we also see patients developing some neurological toxicity. They can present with seizures. So these are all the possible side effects which can happen during the hospital stay, and the WBC count, platelet counts can also drop. But it is definitely a novel therapy where there is a 50%, 50 to 70% cure for these deadly conditions which are relapsed, like high grade B cell lymphomas, which are relapsed, and also these childhood leukemias, B cell leukemias. So we have done two patients. In fact, we have done one patient. We have, and Dr. Aditya has also done one CAR T cell therapy in Apollo Hospital. So we have totally performed this procedure on two patients. We had one patient from Bangladesh, a 56-year-old lady who has been with us for the last 6 years. So she initially underwent the basic treatment chemotherapy in Thailand, and then she came back. She underwent some relapse chemotherapy regimen with us. Dr. Poonam also co-managed this patient. So, and then subsequently, like Dr. Nima mentioned, there's a procedure called autologous stem cell transplant, which is tried first. And unfortunately, after 1.5 years later, the patient relapsed again. And then that is when in 2024, we decided to go ahead with this procedure called CAR T cell therapy. And now it's 8 months since we performed this procedure on this particular patient. I'm sure Aditya can also start with talking about his patient as well. So it's a novel therapy, not performed in many centers in the country. Apollo Hospitals, Bangalore, thanks to Mr. Akshay and the entire management, Mr. Dinesh, and our higher management, who have been instrumental in getting this wonderful facility launched, where we are able to get this procedure performed. And with those few words, I would like to end my talk and over to Anuvinda.
ತಗೊಂಡು ಅಲ್ಲಿ ಕೊಡ್ತೀವಿ. ಹಾರ್ಟ್ ಅಂದ್ರೆ ಇಲ್ಲಿಂದ ತಗೊಂಡು ಅಲ್ಲಿ ಕೊಡ್ತೀವಿ. ಈ ಬೋನ್ ಮರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಅಂದ್ರೆ ಏನು? ವಾಟ್ ಇಸ್ ದಿಸ್ ಬೋನ್ ಮರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್, ಸ್ಟೆಮ್ ಸೆಲ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್? ಏನ್ ತೆಗಿತೀವಿ, ಏನ್ ಕೊಡ್ತೀವಿ? ಸೊ ಅದಕ್ಕೆ ಇಟ್ ಇಸ್ ಕಾಲ್ ಸ್ಟೆಮ್ ಸೆಲ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್. ಈ ಸ್ಟೆಮ್ ಸೆಲ್ ಅಂದ್ರೆ ಏನು? ವಾಟ್ ಇಸ್ ದಿಸ್ ಸ್ಟೆಮ್ ಸೆಲ್? ಸೆಲ್ ಸೆಲ್ ಸೆಲ್, ಯು ಆರ್ ಲಿಸ್ನಿಂಗ್ ಅ ಲಾಟ್ ಆಫ್ ಸೆಲ್ ಸೆಲ್ ವರ್ಡ್ಸ್, ರೈಟ್? ಸೆಲ್ ಅಂದ್ರೆ ಬೀಜ. ಬೀಜ ಮಂತ್ರ, ಓಂ ನಮ ಶಿವ, ಎಲ್ಲ ಮಂತ್ರ ಮುಂಚೆ ಓಂ ನಮ ಶಿವ ವಿಲ್ ಬಿ ದೇರ್. ದಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಬೀಜ ಮಂತ್ರ. ಇದೇ ರೀತಿ ನಮ್ ದೇಹದಲ್ಲಿ ಬೀಜ ಮಂತ್ರ ಇದೆ. ವಾಟ್ ಇಸ್ ದಟ್ ಸೀಡ್? ದಟ್ ಇಸ್ ದ ಸ್ಟೆಮ್ ಸೆಲ್, ದ ವೆರಿ ಪವರ್ಫುಲ್ ಸ್ಟೆಮ್ ಸೆಲ್. ಆಲ್ ಆಫ್ ಅಸ್ ಹ್ಯಾವ್, ಈವನ್ ಅವರ್ ಪೇಷಂಟ್ಸ್ ಹ್ಯಾವ್. ಸೊ ಸ್ಟೆಮ್ ಸೆಲ್ ಥೆರಪಿ ಮೀನ್ಸ್ ಈ ಬೀಜದ ಪವರ್ ವಿ ಆರ್ ಟೇಕಿಂಗ್ ದಿಸ್ ಪವರ್ಫುಲ್ ಸ್ಟೆಮ್ ಸೆಲ್ಸ್ ಫ್ರಮ್ ದ ಪೇಷಂಟ್ಸ್ ಬಾಡಿ and giving back to the patient. So ಎರಡು ರೀತಿ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಇರುತ್ತೆ. ವೆನ್ ಸೇಮ್ ಪೇಷಂಟ್ ಸ್ಟೆಮ್ ಸೆಲ್ ಸೇಮ್ ಪೇಷಂಟ್ಗೆ ಕೊಟ್ಟಿದ್ರೆ ಇಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಆಟೋಲೋಗಸ್. ಆಟೋ ಅಂದ್ರೆ ಸ್ವಂತ, ಆಟೋಲೋಗಸ್ ಸ್ಟೆಮ್ ಸೆಲ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್. ಬಟ್ ವೆನ್ ವಿ ಹ್ಯಾವ್ ಅ ಡೋನರ್, ಬೇರೆ ಯಾರ್ದು ಮ್ಯಾಚ್ಡ್ ಡೋನರ್ ಇದ್ರೆ ಅಥವಾ ಅನ್ಮ್ಯಾಚ್ ಡೋನರ್ ಇದ್ರೆ, ಅಲ್ಲಿಂದ ಸ್ಟೆಮ್ ಸೆಲ್ ತಗೊಂಡು ಪೇಷಂಟ್ಗೆ ಕೊಟ್ಟಿದ್ರೆ, ದೆನ್ ಇಟ್ ಇಸ್ ಕಾಲ್ಡ್ allogenic. Allogenic ಅಂದ್ರೆ from here to there. Autologous means from patient's own body, patient's ಸ್ವಂತ stem cells patientಗೆ ಕೊಡ್ತೀವಿ. But before giving the patient stem cells, what we do is make sure that the patients will have no disease. There are many indications for stem cell transplant. For autologous ಅಂದ್ರೆ ಸೇಮ್ ಪೇಷಂಟ್ಗೆ ಸೇಮ್ ಸೆಲ್ಸ್ ಕೊಡಕ್ಕೆ, There are few indications, not all. So limited number of cases like multiple myeloma, lymphoma, and some childhood disorders. So in this, what we do is first we give treatment. Now treatment can be 4 months or 6 months. Treatment ಕೊಟ್ಟಾದ್ಮೇಲೆ ಎಲ್ಲ ಕಾಯಿಲೆ ಕಮ್ಮಿ ಆಗುತ್ತೆ. That's called response. ಕಂಪ್ಲೀಟ್ ರೆಸ್ಪಾನ್ಸ್ ಆಗಿರ್ಬೋದು, ವೆರಿ ಗುಡ್ ಪಾರ್ಷಿಯಲ್ ರೆಸ್ಪಾನ್ಸ್. ಎಲ್ಲ ರೆಸ್ಪಾನ್ಸ್ ಆದ್ಮೇಲೆ ಏನ್ ಮಾಡ್ಬೇಕು ಮುಂದೆ? ಕಾಯಿಲೆ ಮತ್ತೆ ಬರಬಾರ್ದು, ರೈಟ್? ಡಿಸೀಸ್ ಶುಡ್ ನಾಟ್ ಕಮ್ ಬ್ಯಾಕ್. ಕರೆಕ್ಟ್. ನಾವು ಟ್ರೀಟ್ಮೆಂಟ್ ಆದ್ಮೇಲೆ ಪೇಷಂಟ್ ಒಂದೇ ಕ್ವಶನ್, ಮತ್ತೆ ಕಾಯಿಲೆ ಬರಬಾರ್ದು. ಹೌ ಡು ವಿ ಎನ್ಶೋರ್ ದಟ್ ದ ಡಿಸೀಸ್ ಡಸ್ ನಾಟ್ ಕಮ್ ಬ್ಯಾಕ್? And that's the role of bone marrow transplant. So in certain indications like myeloma, lymphoma, leukemia, and so many other disorders of childhood, when we do bone marrow transplant, that's one of the treatment to take the response to the next level. Deep response ಸಿಕ್ಕಿದ್ರೆ chances of recurrence and relapse ಬಹಳ ಕಡಿಮೆ ಆಗುತ್ತೆ. That's the power of doing stem cell transplant. So autologous stem cell transplant andre patients own stem cells are taken, then high dose chemo is given, then after some time we give the stem cell back to the patient. So what happens? See, bone marrow is what it is, like a factory, as Dr. Neema has told very nicely. It's a factory from where all the cells will come, even red blood, white blood, whatever cells, right? But from there, bad cells will also come. Good cell will also come, bad cell will also come. Bad cell will be killed by the chemo which we give, high dose, right? Now, once we ensure that the high dose chemo is given and the factory is clear, it's like a garden. Factory is clear, the garden is clear, all the weeds have been removed, grass, ye, wo, patti, jhad, sab nikal diya, right? Now the playground is clear. The playground clear ಮಾಡಿ, then we put the bija, like a farmer will sow the seeds. ಅದು playground clear ಆದ್ಮೇಲೆ when we put the seeds, then these seeds will form new crops. That is called healthy marrow. So patient having a diseased marrow now will make healthy marrow. This is how bone marrow transplant happens. So autologous stem cell transplant ಅಲ್ಲಿ ಜಾಸ್ತಿ risk ಇರಲ್ಲ because it is on patient's own stem cells. The chances of infection and having death and mortality is very, very low. But some period will be there where immunity will be low for about a week. In that case, we have infection control and one-on-one care, all that things, antibiotics, supportive care. Otherly, we take care that the patient's stem cell transplant is successful. I hope I'm clear. Yeah, we will have questions later. So stem cell transplant is not.
Uh, Today, we are celebrating multiple things, but this is the second event in oncology that we are having in a short span of 3 weeks now. The reason we are having also is because oncology as a specialty is also continuously evolving. You see cardiac, you see neuro, you see gastro. The new techniques of treating patients have long dried up over the last couple of decades. What was invented in 1990s are being followed now, and yes, definitely there are some improvements, but nothing is as rapid as oncology. What is happening in oncology? As you all know, cancer is the biggest focus now. Cancer is also one of the leading causes for deaths in the world, and everyone is working together to see how we can do path breaking stuff, how we can make sure that we are able to provide the latest and greatest treatments in for cancer. Now, today, actually, for the cellular therapy and the bone marrow transplant unit launch, we wanted to have this press meet in the hospital because we have built a state of the art bone marrow transplant unit in our facility where we can do not only the regular work but also really advanced work like the therapies that our doctors spoke with. Now, obviously, it will be a lot more convenient to meet all of you here, and that is why we have done the event in this venue. But we also welcome each one of you to our hospital where we can take you on a tour to the comprehensive oncology capabilities that our hospitals have. Apart from this, I would also like to highlight the multidisciplinary team, a glimpse of which you are seeing on this stage. This stage itself has the who's who of talent that you can find anywhere in the world in the treatment of oncology. And even beyond this, we have many more wonderful clinicians in the Apollo Cancer Center network. Now, going beyond this, what we also want to tell very clearly is the launch of cellular therapy. Now, as you can see, we started by giving medicines to treat diseases. Then we looked at how we can improve the body condition by adding more immunotherapy, more the cancer resistant cells into the body. Then we looked at getting a donor who has healthy cells and getting that transplanted into the patient. Now we are looking at taking a blood sample from the patient, giving it to a lab, adding immune cells to that blood, and then transplanting it back to the patient. I'm sure in 5 years' time, oncology would have evolved even further. Most of the new technologies that come in at that particular point of time, we might not even have heard. So, what Apollo Cancer Center is doing is, together we are trying to make sure that the best of treatment capabilities, the best of treatment skills are all housed in one place. And by doing this, we are making sure that the patients all around the world are getting the best treatment. And together with all the doctors, with the best infrastructure, and always looking at providing the best service and best service to the patients is what is making us lead this entire program. So I'd also like to thank the support of the entire senior leadership of Apollo, including Mr. Dinesh Madhavan, who unfortunately could not be here, along with the corporate office support, including Dr. Madhu and the promoters, who have helped in making sure that we are providing the path-breaking technology as well as clinical capabilities to the community. So I thank all of them, and I thank all of you also for coming here for the launch of the cellular therapy and the bone marrow transplant. Thank you.